Hello, thank you for joining us in the Department of Surgery's ongoing series on programs and innovations here at the Medical College of Wisconsin. I'm Dr. Tracy Wang, an endocrine surgeon within the department. Today I'm joined by Dr. Kellie Brown, who is in the Division of Vascular Surgery. Dr. Brown is a native of Wisconsin. She obtained her medical degree at the Medical College of Wisconsin before completing her residency at the University of North Carolina at Chapel Hill. She then came back to Milwaukee for her fellowship in vascular surgery and has remained on the faculty since that time. She's now a professor both within the Division of Vascular Surgery within our department as well as in the Department of Radiology. She's also Chief of Vascular Surgeon at the Clement Zablocki Veterans Administration Center and founder and co-director of the Comprehensive Vein Center here at the Medical College of Wisconsin. And that's what we're going to be talking about today. Thanks for joining us.
Thanks for having me.
Can you tell us a little bit about varicose veins and what they are and why it's important for people's health?
Sure. So varicose veins are veins usually in the legs that bulge. And most people think of them as an unsightly problem, but it's more than just a cosmetic issue. So people get varicose veins because the valves in the veins that are supposed to direct the blood from the feet back to the heart stop functioning efficiently. And so blood can sort of back up in the veins and cause increased pressure. The increased pressure then causes the veins to dilate, which then can make them bulge. But the consequences of having that increased pressure in the veins can also cause pain and aching, heaviness, and fatigue in the legs. And so people can be very symptomatic from this. In addition, over time, you can get inflammation in the skin and proteins depositing in the skin that can cause ulceration in the skin. And if people do get venous stasis ulcers, which is what those ulcers are called, that can be very painful and debilitating.
Can you talk to us a little bit about, before we even get to treatment, how people can prevent them if they start seeing them develop and are worried about developing varicose veins?
Sure. So if you start seeing varicose veins or changes that make you worry about that, there's a few things that you can do to help prevent them from getting worse. The first is to exercise and lose weight. So any type of exercise that causes your calf muscles to contract is helpful in emptying the venous system in the legs, and it decreases the venous pressure. So walking, biking, anything that causes movement in the legs will help to empty the veins. So that's helpful. The second thing is to lose weight if you're overweight, because any additional weight in the abdomen increases the pressure against which the veins have to work, and so that can increase venous pressure as well. Elevating your legs periodically throughout the day in order to empty the veins is also helpful. And then lastly, wearing compression stockings is also very helpful. Usually, even if you only wear compression stockings to the knee, that'll oftentimes help with the symptoms to decrease how symptomatic people are. It can help with swelling, and it can certainly help protect the skin against ulceration.
You've mentioned the symptoms that people might feel, and not just the appearance of them, but pain and developing ulcers. How does somebody know when some of these things are related to varicose veins and when they need to seek treatment for it?
Well, if someone has visible bulging varicose veins and they have any of those symptoms of aching, heaviness, fatigue, usually the two are related. Occasionally people will have those type of symptoms and not have visible varicose veins, and it still can be related to venous insufficiency. Some of the veins in the superficial venous system are deep enough under the skin that they're not visible to the naked eye. So if the valves in those veins are inefficient, you can still have symptoms and not have visible varicose veins. In that situation, it's typically when you notice the symptoms after a long day or after prolonged standing that you have to start to suspect that the veins are part of the problem.
Okay. And what types of treatment are available for people with varicose veins?
So there's a lot of treatments, especially in the past 5 to 10 years, things have been developed to treat these with minimally invasive techniques. And there's some even newer things coming down the road that'll make it even less invasive. Right now we have available ablation techniques for the saphenous vein, which is one of the major veins in the superficial system, which involve just local anesthetic and can be done in the office. And it involves a heat generator, either radiofrequency or laser, to essentially cauterize the vein from the inside. And that's done through a little incision that doesn't even require suturing to close. the other technique that we use frequently is sclerotherapy, which is just the injection of a chemical into the vein to get the vein to scar down and go away. Those are the major treatments that we have now. In addition, we have microphlebectomy, which is taking out the visible varicose veins through tiny incisions, once again, tiny enough that they don't need suture repair. Coming down the pike are some non-thermal ablation techniques that are still done through a little incision but don't require heat in order to ablate the vein. So there's less anesthetic required and less recovery time.
And can you tell us a little bit about how you know which technique is going to be appropriate for which patient?
So when we see a patient in the office, one of the first things we do is get a duplex ultrasound of their veins. And what this does is map out where the valves are not working correctly, in which veins they're working and in which veins they're not working. We have to look at both the deep system, which is the major drainage system of the leg, and the superficial system, which is the system that most commonly is involved in varicose veins. As long as the deep system is open and functioning, getting rid of the veins in the superficial system is a reasonable course of action. So we check both of those. And then with the ultrasound, we map out where the insufficiency is and can come up with a treatment plan that will treat only those veins that need treatment.
And if someone has one of these procedures, what is the recovery time? You know, what can they expect in terms of return to physical activity and return to work?
So it depends. With sclerotherapy, there really is no recovery time. There's just the treatment time. And you do have to wear compression stockings for several weeks after the treatment. And I do ask that people limit exercise for 1 week after treatment. With the ablation techniques or with phlebectomy, it's also no exercise for a week, but there's a little bit more recovery time. There's some bruising and soreness that is typically treated with just over-the-counter medications, and I typically advise people to take the day of the procedure the next day off of work. But by that third day, the majority of people are back to work.
And in terms of insurance coverage for these, does insurance typically treat or does insurance typically cover the treatment of varicose veins with these techniques you've described?
So if the patient is symptomatic and we can document that they are symptomatic and that they have venous insufficiency, insurance typically does cover these procedures. They do often require a trial of conservative therapy, which includes several weeks of wearing compression stockings to see if that will help treat the symptoms. But when the patient has a trial of conservative therapy and still is having symptoms, they will often cover the treatment.
Okay. And as I mentioned earlier, you're the founder and co-director of the Vein Center here at the Medical College of Wisconsin. Can you tell us a little bit about that Vein Center and why someone seeking treatment for varicose veins might want to talk about that with you or your other partners in the Vein Center?
Absolutely. So the Vein Center is been founded between as a co-directed effort between the Vascular Surgery Division and the Division of Interventional Radiology and the Department of Radiology. So we have all board-certified vascular surgeons and interventional radiologists who are well aware of how to treat venous insufficiency. I think the thing that sets us apart from other vein centers is that we're very evidence-based, and we are also fairly conservative in that we're only going to recommend treatments for what the patient needs. We're not going to recommend treatments that are superfluous or aren't really necessary to treat the patient's symptoms. Mm-hmm. We have 5 practitioners there, all of whom make venous treatment a central portion of their practice. So this is something that we take very seriously, and we treat the gamut of venous disease. So we're very well versed in how much to do and when to do it.
Great. Thank you very much, Dr. Brown. Thank you again for joining us in this discussion on varicose veins and the Vein Center here at the Medical College of Wisconsin.